All right, so I kind of toyed with what to call this case because, the one I did last month was also slow weight gain, but we really should have called that one provider failure because that was really what was happening there. But I'm calling this one slow weight gain with a referral. So here's the history. It was a first-time mom. She's a G1, P1. Baby was conceived via IVF for unexplained infertility. She didn't have a lot of miscarriages. It just took her a while. They tested both mom and dad and didn't find anything, so they did IVF. She did have a history of breast augmentation 10 years ago. The scar is in the inframammary fold, and mom reports that it was just to increase size, that her breasts were otherwise normal. She said she did have breast changes in pregnancy. And the only thing I had written down on my notes for her that was unusual was a leptin resistance, which, to be completely honest, I never looked it up. So hopefully it didn't play a role in what was happening with her because I'm a failure. And that I totally realized I forgot to look that up. But anyway, this is what I have for her history. Wrong way. So she had a vaginal delivery at 39 weeks. The baby boy was born at 6 pounds, 9 ounces. He was exclusively breastfeeding in the hospital, but the major concern for her was slow weight gain. So she called for visits due to poor weight gain and that the baby was not back to birth weight when she called me. So this is not the baby, but this is kind of what the baby looked like when I saw him. So he was feeding on demand, give or take 2 hours. He would feed on both breasts. She had seen 2 other lactation consultants before she saw me at an outpatient clinic, but she was over packing up the baby and going in there, and she just felt like it was really frustrating to go there at that time. Like sometimes he cooperates, sometimes he wouldn't, and it just wasn't a good experience for her. So she reached out to me so I would come to her house. At her last visit, I guess somebody had suggested she start pumping. So for a couple of days before I saw her, she pumped twice a day and got a total of 45 mLs. She had a Spectra pump and also a wearable. I think it was a Mom Cozy or a Willow or something like that. And she was using the wearable primarily. All right. Any questions so far? All right. So
When did he pump? Was it immediately after nursing?
I don't know the answer to that. That's a good question. I don't really know. Um, I didn't give her that instruction, and I was going to change the plan anyway, so I didn't really dig too deeply into that. So when I saw her for the first visit, the kid was 3 weeks old. His weight today was 50 grams. So if you remember, or we went back, his birth weight was 29.77. So he was just now at birth weight at 3 weeks. At his last LC visit, he wasn't back at birth weight. Baby was really eager to nurse, but he had very few swallows. He had good voids, low stools. Mom kept reporting the diapers were green. I didn't actually see them, so I don't know if they were greenish yellow or if they were truly green, but it was definitely not an oversupply situation. Baby transferred 10 mLs from one breast, 5 mLs from the other breast. He seemed content after feeding, but this is a 3-week-old kid that's just now back to birth weight. I think he's just sort of been underfed for a long time. I did measure and provide the correct flanges for her because I wanted her to use her Spectra instead of the wearable. But of note, if you look at this picture, this is not her. This is the closest picture I could find, but this is similar to what her nipples look like. She had long nipples, and this is a 6-pound baby, a 6.5-pound baby. He was only getting on these long nipples because remember, the nipples extend 2 to 3 times their length in the baby's mouth. So with a tiny mouth, those nipples weren't getting very far back in the mouth. So I kind of was thinking, is this an issue with the baby compressing the nipple and not getting enough milk? But I didn't get to that yet. So my plan of care was to wake the baby to feed at least every 3 hours, which she was basically already doing. I taught her how to do breast compression during the feeding to help facilitate milk transfer. and also to stimulate him, keep him active. Then I wanted her to use her Spectra pump after every breastfeeding session. And I explained, if right now you have a low supply, because if baby takes this much at every feeding, your body just eventually starts saying, okay, I'm going to keep giving you this much, but baby really needs this much. So we need to increase that demand so that your supply will go up. So the pumping after breastfeeding was to increase the supply. And I wanted her to start supplementing with any breast milk she had to start. So that's where we started. And she was getting probably about 1 to 1.5, sometimes more, less, excuse me. Yeah, I did do the weighted feed. So the kid weighed 30, 50 grams. He took 10 mLs from one side and 5 mLs from the other. Does that answer that, Maya? Okay. All right. So then I saw her 2 days later to do a follow-up and see how things are going. So if the kid was getting half an ounce 10 or 12 times a day, really wasn't getting much milk. But then she started to, because she was pumping, she had more milk to give him. So his weight had increased. So he went up 3.5 ounces from the last time I saw her, which is great. That was really good. The diaper output increased a little bit. Over 8 pumpings, mom collected 6 ounces. So she didn't have it exactly written down, but she knew what she collected total, and she fed whatever she had after the feedings. So this is the range of milk that she fed after every feeding, and just feeding that little bit extra, 6 ounces extra, boosted his weight 3.5 ounces, which was awesome. And again, the baby had the same milk transfer at the breast. So just 15 mLs at the breast, and then she supplemented with whatever she collected after that. All right, any questions on this one? So the plan of care was the same, except I needed her to supplement more than what she was getting. I really wanted her to see that the baby was getting closer to like 2 ounces. So I said to give either express breast milk. I talked to her about donor milk. She could get donor milk like 15 minutes from her house, but she wasn't interested in that. So she gave formula to make up the difference with what breast milk she didn't have. Continue to use the Spectra to work on the supply. It had only been 2 days, so I didn't expect a huge increase in milk supply yet, but just to keep practicing with that. So then I saw her 3 days later, and the weight had dramatically increased, 6.5 ounces, since we started giving this kid 2 ounces at every feeding. He's finally getting enough milk. He was really eager to breastfeed, but again, he still only transferred 15 mLs from the breast. His diaper output's awesome, but the supply is still low. Mom is still only getting like 1 to 1.5 ounces, despite being really consistent with the pumping. And baby's transfer at the breast really wasn't changing. So there were 2 thoughts that I had at this visit. One, I was thinking back to the nipple anatomy. If this nipple is just so big, long, that the baby can only latch on the nipple, is that the reason that he's not able to transfer much milk at the breast? Because he's really compressing the milk ducts and not getting much milk out, and sort of negatively feedback, inhibiting the milk supply. So I said, why don't we try a nipple shield to see if it contains the nipple and if we can get the baby latched on a little bit deeper. So she tried that for a day or 2, and it didn't really make any difference. So she just abandoned it on her own. The other thing is, I really was thinking, like, I want you to get another opinion just to make sure there's nothing I'm missing, just to get a look at your hormones because of that unexplained infertility, because I don't really know if her breasts were normal beforehand. She was on birth control, so she wasn't having regular periods for a while. So I just felt like it would be a good idea to refer her to breastfeeding medicine just to see if if they could draw her labs and just to see what they thought. So I referred her to Dr. Rubin, and she did a telehealth visit. So I said, keep doing the triple feeding plan, giving 2 ounces, and let's see what the breastfeeding medicine physician says. So the breastfeeding medicine physician saw her, drew the labs, and everything came back normal, which is great. But she did say that, it is normal for all moms to have a little bit of insulin resistance after delivery. And we do have evidence that tells us that insulin resistance can inhibit the amount of milk you make. And whether or not she had gestational diabetes, which she didn't, if every mom has a little bit of this, maybe this mom seems to be a little bit more it's more problematic for her. So that a low risk intervention would be to try goat's root. So Dr. Rubin put her on goat's root, following the instructions on the bottle, which I think says like 4 to 6 pills per day. And I think she was dividing it over like three times, like taking 2 in the morning, 2 in the midday, and 2 at night. So then I saw her almost 4 weeks later. This baby has increased 2 pounds. This is all since starting the goat's root and something else I'm going to tell you. I did a weighted feed today, and he has doubled how much he takes at the breast. So remember, the max he ever took from me was 15 mLs, and now he's taking 30. Mom has changed up her plan because she actually started going back to work today. So she wanted to just breastfeed him at night and pump and bottle feed during the day. So she breastfeeds him 3 times at night, only breastfeeding, no supplementing afterwards, and he's happy and content. But mom is pumping and bottle feeding during the day. She got frustrated on her own and decided to look on some mom groups, and she found the Eufy pump, which is this wearable pump that originally, first thing all of us lactation consultants are like, wearables, I don't know about this pump though. It's made by a robotics company. They make like robot vacuums and a bunch of other things. But this pump is pretty interesting. So it has a heat function built in, and we generally are like, don't use heat. But when we think back to the research that we have, there was a study where they warmed the flanges and saw an increase in milk output. So it does make sense that if we use some heat on the breast and it draws blood flow to the area, that potentially more milk will come out. So I did give her the right size flanges, and I did give her inserts for her other wearable. And she said with this Eufy pump, she doesn't use the inserts, so she's just using the 24 ml, whatever the standard is. She said it, like within 2 days, 3x'd her output. I mean, crazy. So was it the goat's root? Was it time? Was it the Eufy pump? Who knows? But this is a pump that maybe we need to give a second look to, and not just be like, oh, don't use a wearable, because for this mom, it seemed to work really well. So she's done with me. I mean, and she can obviously reach out anytime, but she's done. She met her goal. She's doing really awesome. Her baby is gaining well. He's transfers well at the breast, and she's happy. So what questions do you guys have about this case?
I just wanted to say about the Eufy. I was actually watching Allison Tolman's video about her favorite pumps of 2025 the other day, and she mentioned that as one of 2 wearable pumps that she was recommending. It was like, I don't know exactly which one. It was like Eufy S something. I don't know if it's
yes.
And yeah, she mentioned about the heat.
Amazing. Yeah, no, I'm definitely keeping it on my radar now, knowing that she had a 3x output. I mean, we were manipulating everything with the spectra. We tried like 2 or 3 different flange sizes. We tried different amounts of time. We tried hands-on pumping. We tried all of those things, and it really wasn't leading to any significant differences. And when she changed to this other pump, I mean, it was dramatic.
And she was pumping the same number of times. She wasn't pumping more because it was more convenient.
Exactly. The same number of times. Actually, less now because she's not pumping overnight. But yeah. Pretty interesting, right?
Yeah, I had a couple of questions.
Sure.
Um, First of all, why did you decide not to have her start supplementing on after the first visit? Because it was
Yeah.
because you were coming back soon enough that you felt like it was going to be okay to see your
Yeah.
supply
Yeah.
increased a lot in that period from pumping.
Yes. I mean, my first thought was, let's see what happens if we just increase the the supply, or if we just increase the stimulation to the breast with the pump. Let's just see what happens. And I knew I was going to be back in a short enough time period that it wasn't going to like cause harm to the baby. It's just sort of persisting what he's already been doing. So I think that's why. If he were, if she were more nervous, like, oh, the pediatrician's really upset or something like that, I might have started it on day one. But she had only pumped twice. So I thought, well, let's see what happens if we pump 8 times, and maybe you'll get some significant milk out that you can give to the baby.
Thank you. And my other question is how you wrote about her nipple anatomy in your notes in a way where it would be like okay if she saw it.
Oh yeah.
Because
Um,
like maybe she doesn't know she has big nipples.
we did talk about it. No, I talked
Okay.
about it exactly. I explained to her that the nipples extend 2 to 3 times their length in babies' mouths. And sometimes when your nipples are a little bit longer, that can lead to more pinching happening. So I said that, and then I would say, did you ever feel pinching, or did you ever notice any nipple damage or anything like that? And she's like, yeah, I definitely had that in the beginning. And I said, well, one thing that we could try, because I think it looks like baby's only getting on the nipple, but if he gets back here, he's going to get a whole lot more milk and a whole lot more milk transfer. I said we could try the nipple shield to see if it helps to get that deeper latch. So I think I just sort of described it as long elastic nipples or something like that. But we definitely talked about it.
And then maybe also with time, since the baby's breastfeeding at night, maybe it could be more effective after the mouth got bigger.
Absolutely. I did definitely address that it changes over time as the baby gets bigger, for sure. But she didn't like the nipple shield. It didn't seem to make a difference. So yeah, we didn't keep using it. All right, Maya.
Two things. One was about the green poop that you mentioned. Like you said, like, oh, well, maybe the poop was green, maybe it wasn't green, but like you don't think it was an oversupply. But something that I learned with my first was that like the poop, like when we talk about green poop and oversupply, we're talking about the baby getting too much fore milk and having like lactose overload.
Yeah,
And sometimes that happens when they're only getting fore milk because they're not feeding well,
I
because
agree. Yes.
not first milk. So like
Yeah.
sometimes it's not a red flag for oversupply, it's a red flag for poor milk transfer, which is sounds like
Yes.
exactly what's
Which is what was
happening.
happening here. Yeah, definitely. Yeah.
Um, the other thing that I was gonna ask about was like it sounds like she changed her plan from what you said to do, which was the same thing at every feeding day and night,
Mhm.
to a plan that was different during the day versus the night.
Mhm.
When I made my care plans in the class, I always did what I thought was the best recommendation, which is that you should be pumping more overnight.
Right.
And when I was parenting, I did the same thing.
Mhm.
But I found with patients that they're really hesitant to like do the triple feeding plan overnight as
Overnight. Yes, totally.
so what do you do about that in person? Like how do you kind
Yeah.
of balance what the ideal recommendation would be versus what's
Yeah.
actually realistic for the patient?
So yeah, that's a great question. So first, I would say that the reason that she decided to do it this way is because she knew that work was starting, and she said the baby's going to take bottles all day and just nurse at night. So I'm going to just start practicing like that. So that's why she switched to that. She was doing pumping overnight in the beginning. But yeah, for my moms that feel really sort of overwhelmed about doing the whole triple feeding plan at night, depending on how the baby is breastfeeding, if the baby is a crappy breastfeeder and not really transferring much milk, I might focus on the pumping piece of it. So the way that I tell them is milk is good at room temperature for 6 hours. before you go to bed, put all the things that you need to pump right on your bedside table. When you set your alarm, sit up, pump, or however you're going to do it, and just put the milk back on the bedside table and leave it there. You're going to be up again before 6 hours is expired, and then you can put it away and clean it up. That way, it just happens right away. So you don't have to get up and clean anything.
Yeah, I think like the thing that I probably noticed the most in the difference between the
I don't know
ideal
how to do this, Lauren.
the actually finds realistic,
Mm-hmm.
like very in line with what the pediatricians are telling them also I've found, which is during the day, feed every 2 to 3 hours, and at night you can give them a longer stretch. So I had a mom who was feeding her newborn who wasn't feeding very well
Mm-hmm.
at night every 5 hours, but she only counted the 5 hours from the end of the breastfeeding session,
Oh
no matter
boy. Oh
how
boy.
true that that wasn't what she was supposed to be doing.
Yeah.
And she was also triple feeding, so she was like the feeding session was an hour. So she
Oh
was
boy.
really
Yeah.
needing to be every 6 hours at night.
Yikes.
And
Yikes.
like during the day, it was every 2 to 3 hours, but it was every 3 hours
Yes.
from the end
And
of the feeding.
yes. Wow.
And like she just wasn't really picking up my like, no, that's when I say 3 hours, that's not what I mean.
Right. Yeah, we do definitely have to clarify it. I just went to a visit today and I was so grateful that the grandmother clarified that because the dad was like, "Oh, we've been doing it wrong the whole time." And I'm like, "No, it's start to start. It doesn't matter how long it takes. So let's try to make it as efficient as possible." Yeah. Alexa.
Just hopping on what you were talking about, Maya, I feel like lately I've been, when I do have a triple feeding recommendation, I emphasize to the mom that like, this is not easy. This is very hard. Do you think this is manageable for you? And like, even not triple feeding care plans, I try to always end of like, here's what I think would help. How do you feel about that? Like, how does that look with your toddler in the room too? Or like trying to like ask about that kind of stuff before I leave. And then I find that sometimes they'll stick to the care plan easier if we tweak it to what they say is actually manageable.
Yeah.
But Margaret, I was going to ask you, how did you decide at, I think it was the second feed when she had started like pumping every time and the baby got 6 ounces that 24 hours.
Mm-hmm.
When you came back 2 days later, the baby had gained like 1.75 ounces a day or something in the last 2 days.
Yeah. Mm-hmm.
So, I mean, yes, in my mind, like a baby should be taking like a 2 ounce bottle at that point or 2 ounces of feed, but the weight gain was good.
Mm-hmm.
And then the next time when you saw her 3 days later, the baby was gaining 2 ounces a day, which is kind of like double the recommendation. So how do you decide in those points, like if their weight is good to still tell them to supplement more?
Yeah, that's a great question. I mean, I think mostly because the pediatrician was sort of at that point breathing down her back a little bit. She was going to have to go back again and get another checkup. And I think it was really just to like, let's see if we can push a little bit more to get to a good place.
Okay.
Because it would have just been slow growth.
Yeah.
Consistently if we just, if baby's only getting 0.25 after some feeds.
Right.
It's not going to be enough. And the kid's probably not going to be really happy with that. So if we increase it to more like what the baby actually needs, they're going to be happier. Everybody's going to be happier.
Yeah. Okay.
Yeah. Naomi.
Well, to get back on the triple feeding discussion.
Say it again.
To get back on the triple feeding.
Yeah.
One of the things that I often talk about with people is just kind of going straight to the idea of double feeding at night, which I think we've all been talking about anyway. But a lot of times when I'm explaining triple feeding to them and they're looking like they're freaking out, like, oh my gosh, I'm not gonna be able to do this. And I'll say like a lot of times what people will do is just double feeding at night. So the breastfeeding portion is practice, the short part at the beginning. So they're doing practicing all day long. You can skip the practice at night so everybody can get some sleep. We're going to double feed.
I love that.
I like your idea about the leaving it out. Sometimes too, if people don't feel comfortable with that, then you can also have them make a little station with the freezer, the cooler, or the stairs chill or whatever. Like just don't let your feet touch the floor.
Exactly.
Stay in bed.
Right.
Keep your pump there.
Exactly.
Keep your feet in the bed.
Yes.
Do your thing. Pump, pump, pump. Right back to sleep. Just
Yes.
everybody maximizes the sleep,
Yes,
and
exactly.
you can like make this work. But also, as a just point of discussion, I would love to, maybe not at this meeting, but another time, I would really like to talk about triple feeding and um, whether there's a way to just do it better for clients, because
Yeah.
I see in our doula community, we have postpartum circles that we run, and the PTSD
Mhm.
that we see coming from triple feeding is super real.
Yeah.
And what you hear from kind of therapists, so we had also an in-service for our doulas last week, and we had somebody talking about trauma-informed therapy, which is really awesome. We talked a little bit about it in our
Yeah.
program, but it was a really nice, like 2 hour session with a therapist. It was awesome. And I mentioned about this, and she's like, "Oh, that's something I hear a lot about."
Yeah. Yeah.
And I hate to feel like our profession is responsible for causing trauma to people
I agree.
from
Yeah.
triple feeding. We know it works, and we also know it's
Yeah.
leaving
So,
people with trauma. So I'd love to just like brainstorm at some point, like how we can do this better,
well,
even if it works.
yeah. I mean, first of all, we need to get moms off to a better start. That's the first thing, and it's not something we can solve ourselves. It's because our system is backwards. And Megan and I talk about it weekly. Moms are kicked out the door before they even had one good feed. So we need to do a better job of getting them off to a good start. That's the first step. But then the other thing is, and I heard Marsha Walker talk one time at a conference about low milk supply and all of the causes that sometimes we won't even know, because remember, the milk line is formed on you when you are inside your mother's body 7 weeks or 3 weeks, really, really early. So if she was exposed to some kind of something environmentally, that can affect your breast development when you are a little embryo with a streak that forms your milk line, that we will never be able to connect the dots on. We only know like the very tip of the iceberg about why low milk supply happens. A lot of what we think is related to practices, but there's still probably a whole host of other things that happen developmentally that we may never understand. So when we do triple feeding, the objective of it is to feed the baby and protect the milk supply at the same time. And it can be really stressful on families. That's why I am not a fan of the SNS, like almost ever, because I think it's too much to put on the birthing person themselves. It's better to get somebody else to take part of it, because I want the whole process to take no more than like 35 minutes. Like maybe we only breastfeed on one side and then we hand the baby off for the supplement. If the baby's not a great breastfeeder and not transferring much, let's do some practice, but like maybe not the whole feeding at the breast. Maybe you nurse on one side and then somebody supplements and then you're going to pump. And we do that for a couple days and then we reevaluate. But I'm not a fan of the SNS because I think it's too much to put on most parents. And I do think it causes all of that PTSD that you're talking about. I actually just interviewed the same breastfeeding medicine physician that I referred this patient to. So I have an interview with her coming out talking about triple feeding, probably in a month. I'm not sure when, but yeah. So that'll be an exciting conversation, I think. But yeah, we have to do it as limited as we can. But sometimes, like my first case presentation, it took 9 weeks to get that mom to a place. Most moms can't handle that. But this was an experienced mom and she was going to make it happen no matter what. But yeah, we do definitely have to, balance it all. That's why getting somebody else involved is really key. And most of the time, the partners are pumped about being able to feed the baby. So, if you can get them involved, that's the best way. Megan.
I was just gonna say, like, I guess kind of it's a little redundant now, but I just had a triple feeding, such a same situation, very similar, um, recently, and this is what I say all the time, whether I do it in the hospital, or whether I do it in person or whatnot, and I tell them all the time, we're gonna make this plan, and a lot of times in the hospital, they're like jaundice impact, so they're a sleepy baby anyway, and I can't get them to wake up and I can wake them up, but I can't get them to breastfeed.
Right.
And so we talk a lot about that the at the breast part will come later. And that if the baby is really sleepy and you can't rouse them, like we don't spend more than 10 minutes trying.
Yes,
And if you want to do less, that's fine too. We need to
Love
keep
that.
you in the game, so make the feeding cycle as short as possible because we're going to have to start it all over, pretty quickly. And
Yes.
so and the mom I had recently, I said, if this is too much, which it can feel like that, and maybe it doesn't feel like it right now, but in 2 hours or in 12 hours or in 24 hours,
Yep.
it can change. And I'm okay, reach out, let's reassess. But I kind of give them that same green light that if you want to do it every other feeding, if you want to drop the breastfeeding at night, now if I have a kid that's like nursing like a champ, or the feeding behavior increases when I come for the second visit,
Yeah.
I usually go, this is the part where, remember I told you, we're going down, we're going up, we're kind of at the peak where it's really, really difficult that because I'm adding all the things and you're breastfeeding longer, but I really need to see that before I can drop the pumping and the supplementing. And so I think we all have a very similar strategy, even if it looks different.
Yeah.
But I also give everybody the out that if you don't want to do this right now because it's too overwhelming, we can work on actual direct breastfeeding later. But most of the time, that's what they want. They want that first.
Right.
But I'm like, we have to build before we can get there.
Yeah, definitely.
So, yeah.
I love that. Thank you, Megan. Amy.
I was just going to say that I know we can't save the whole world, and I'm sure that's what causes a lot of frustration at times. But I feel like it's how quickly people get behind the eight ball is so frustrating. Like it really doesn't take long at all for you to get behind and be in this situation in the first place. And if we had a little bit maybe more prenatal education or just, I don't know, like the communication is so hard with people, like, no, I don't mean 3 to 4 hours. I literally mean at the most 3 hours, like, and those differences can mean success or a triple feeding plan.
Totally.
So yeah, it's just hard, but I feel like we're behind the eight ball with the triple feeding, and I wish that didn't have to be the case so frequently.
Absolutely. Absolutely. So Amy, tell us a little bit about your friend because you are helping your friend right now, and then you asked me an important question that I want you to repeat.
Sorry, my husband took my kids to the store to distract them, and he's home now. Okay, so my friend, she just gave birth on Wednesday, and she's really, really determined to breastfeed. Like, also, she's an Ironman athlete, so she's like got a lot of grit and resilience. And I knew that she would just try really hard, but she texted me in the hospital, and it felt like so out of control because I'm not there. I don't know what's going on, and she was induced and had a really long labor. And then I've just been following along with her, like answering all of her questions day and night. And I knew that she was falling behind because she couldn't really get baby to latch and was just doing hand expression. And I know that I've had two babies, but I think from this perspective, it's crazy how moms are just kind of left. Like she never got baby to latch and then she just went home.
Right.
And
it's crazy.
It's like
crazy.
3 to 4 days till the next appointment. And that 3 to 4 days, I mean, it's like that's a lot of weight loss if you don't have anything figured out. And so anyway, I texted Margaret over the weekend because I was like, I think it's time to tell her we need to get her pumping. And I think I was even late telling her that. But anyway, I've just been today, it was her pediatrician appointment, and she was texting me. And, I don't want to be like overbearing. I'm a friend, so I'm kind of waiting for her to text me. And it had been like 3 hours, and I was starting to spiral. I was like, oh my gosh, like I figured the baby had a high percentage of weight loss because of how long it took her to start pumping. And also I found out in hindsight I was like, I called her. I was like, have you been feeding this baby every 3 hours? And she was like, yeah, 3 to 4. And I was like, oh no, this isn't good. I just had like the writing on the wall. And yeah, so I was like spiraling. Oh my gosh, is this baby jaundice? Like, did she have to go back to the hospital? Like, I was just really stressed. But um, it ended up being okay. Like, baby lost 10%, but the pediatrician recommended watched her nurse and saw like that she had a plan. Like she was pumping every 3 hours. The milk was coming in and like she was gonna make up for that and had a plan. And so she said just follow up tomorrow. Um anyway, I was just like, Margaret, I have been feeling so much anxiety because like it just feels like the stakes are so high and you're worried about the mom and the baby, because the stakes are high. You don't want the baby to have to go back to the hospital and like it's it's those first few days are so hard with how frequently you have to nurse and nobody knows what they're doing and like who know like I was just telling my husband it's crazy how different scenarios can be. Like someone could have a baby with all the like red flags up of all the like risk factors and do amazing, and then someone else could have no risk factors and not get their baby to latch. Like it's crazy. But anyway,
Yeah.
I was like, is this because she's my friend or is this how you feel? Because I wasn't expecting to feel this much anxiety.
Yeah. So my answer is it's probably individual. Everybody's probably different. But for me, when I have patients that are really struggling, aren't doing awesome, I feel it and I worry about them. Even though they're not my friends, I do. I like think about them a lot. And I will, if I don't hear back from them, like if I text them to check on them and I don't hear back from them after a day or two, I'm worried. I'm like, oh gosh, what's happening? Are they okay? Yeah, I don't, it's not just you. I definitely feel it. I feel like a heaviness for when I have a few patients that aren't doing awesome. And I wish that I could walk in with a magic wand and solve it, but it never works like that. Well, that's not true. It does work like that sometimes. If it's something as simple as like, you just need to stop holding your baby upside down and actually put them at the breast, and then it won't hurt. Yeah, sometimes it is that easy, but most of the time it takes time. These are new, even if it's not their first baby, it's a new dyad and they're learning this dance together. And every single baby is unique and their mouths are unique. And, their mouths aren't super strong when they're born. And it takes a little bit of time to build all of that. So, I feel
And
it.
it's hard to like let go of control, like because you can't make them do anything
Right.
and you can
Exactly.
give them all the information, but then I was also like, did I miss something? Like, am I telling her everything she needs to know? I don't know. I feel like
Yeah.
it's gonna be exhausting.
It is, but it's the best. It's the best. So there's a book. I've not read this, but it was recommended on the what do you call it? Lactation Business Counseling podcast. They recommended this Keep the Fires Burning, Conquering Stress and Burnout as a Mother Baby Professional. It's not very big. I probably could read it in 2 nights, but this is on my list of things to read at some point, and I definitely recommend it because it is a lot. It's a lot. We wear a lot of hats in this profession, and I think most of us kind of take on that the feelings of all that what the mom is going through. But yeah, I you're not alone. We all feel this, I think. Megan.
I am feeling it right now.
Mhm.
I do the same thing, but something I know that I heard like really old school nurses, and it sounds a little harsh, but they're like, you can't want it more than them. And
Right.
I know that.
Mhm.
At the same time, I also realize we're probably in this profession. If even if you haven't nursed a baby or been through a challenge or whatnot, your heart is really, really driven to meet this goal. This is a hard goal to achieve. It is not always, pouring out with money too. So like it's not like you're rich. And I have just realized that they do want that magic wand. And when it doesn't happen in one visit and it doesn't happen in two visits, then they kind of go into what I have a friend who has a business that's unrelated to this, and she calls it into she calls it the Mary Kay world and the Mary Kay she goes in the Mary Kay fantasy world is what she always says. She goes, I've done my best, and I had to realize that that's not just that industry, it's
Right.
ours too.
Yeah.
And they want follow up, they want all that, but they don't want to schedule another visit, and they wanted it to happen. So I realize that my passion and my determination to get to taking 12 weeks to get to exclusive breastfeeding with my kid is not everybody else's
Right.
path.
Right.
And they're not like in a bad way. They're not as determined as I was, and that's okay,
Yes.
whether they're going to go to formula feeding or go to exclusive pumping or whatever,
Mhm.
or they find someone else, to help them, that maybe they find them at the right time in the right place and it
Mhm.
works out better. It's just hard to swallow because you want to help everybody, but it
Yeah.
doesn't mean that you did a bad job or that you forgot something. It legitimately just has a lot to do with that person's desire at that time.
Absolutely. I had two patients that I don't know, I really don't know what happened. One of them, her baby was losing weight, was bright yellow. We had to start pumping and supplementing a little bit, and she was getting donor milk from like her sister because she was breastfeeding, and her milk was not coming in, and I really wanted to uh she was resistant to increase the volume of supplementation as the baby got bigger. And then she started turning to other people. She told me her nutritionist told her it was totally normal for it to take a couple of weeks for your milk to come in. And then she just stopped responding to me. And I'm like, okay. I mean, I like really was upset about that for a long time because I'm like, first of all, that's so wrong. And second of all, like, what did I do? Like how did I handle this wrong? I had another patient one time that was referred to me by this doula client that sends me tons of patients, and they were really happy to have my help. And I saw them like three times back to back because the baby was struggling and getting them on the right path. And then suddenly she like ghosted me, like wouldn't respond to my text or anything. And I was like, what did I do? Did I say something? What did I do wrong? And I never heard from him again. It was the weirdest thing. But of course, you take that personally. But you know what? Maybe she decided she didn't want to breastfeed. Who knows? It's who knows? We can only do what we can do and then move on to the next thing and just, make sure that we just provide the best care to all the patients we take care of. And, we can't, like you said, we can't want it more than they do. And we can't be responsible for the feeding choices they make. Maya.
I think that this is like so right, and I definitely feel that like kind of burnout that comes from not just like not knowing if you did enough to make a difference, but also like sometimes it's not knowing if you were actually needed to make a difference. Like if you have one or two visits with somebody and they do fine and like you didn't really have any notes, like they just kind of check the box with the lactation visit. Sometimes you're just like, okay, like that's great
Yeah.
for you. Get
Yeah.
the thing. But like sometimes you leave a visit where you saw that mom like 4 or 5 times and now her baby is doing great and they weren't at the beginning and
Right.
she was so much more than she did before and like you
Those are
really
the ones that really burn
really
you
did
up.
know that you made a difference and that's
Yes. Right.
really emphasizing. Like it's easy for me to think about those cases more
Hmm.
than the cases where like they just sort of fizzled out or
Absolutely.
yeah.
Absolutely. I feel like some of those ones that are just sort of checking the lactation box, they're uncomfortable. They almost makes you feel like they don't want you to be there. That you come to do the visit and they're just like, all right, well, let me just do this real quick just so I can. But yeah, you're right. You think about the ones where you did make the biggest difference, and moms remember that.
Yeah, I was gonna say like I had a Rachel's family. I had a case where like she was a third time mom, like didn't have any, it was a little different this time. She had some like nipple pain that she didn't have with the others. I made slight adjustments. It wasn't that big a deal. I scheduled like a follow-up with her, not for what was going on, but to introduce a bottle. and talk about pumping, you know, because she said like her first two were taking 11-ounce bottles 3 times at daycare. And I was like, whoa, that's like crazy. Let's talk about like
Yes.
what normal looks like.
Right.
And I went there, and when I showed up, she was like, yeah, like I don't really breastfeeding's going well. I'm like, I don't really want to go back to work, so I'm just not gonna do bottles. And I
All
was like,
right.
I'm glad I drove all the way up here.
Well, at least you got to do a visit, right? Weigh the baby at least. Weigh the baby so you can document that you touched the baby. Alexa.
I just wanted to chime in that like the emotional burnout is real, and I can't quite figure out if it's just because I'm new to private practice and I'm still learning things, or if this is just always how it is. But I think I'm especially feeling it in the scheduling aspect of like when I look at myself and my business, what hours do I want to work? I'm homeschooling my little kids. And then you know, I have all these them scheduled out, and then you get a mom and you show up and you're like, oh my gosh, your baby lost weight or your baby didn't gain weight. Now you need to urgently see me in 2 days, like where those boundaries are. And so that's like a tricky emotional part too of like, how much do you inconvenience your own life to then support these moms? And you want to, but then I'm like, if I do that repeatedly, then that burns me out from helping moms in the long run too.
Exactly. Yeah.
And then another one, I just had my first case of like a pediatrician totally like railroading your plan that you've been trying to work on. I was just checking in with my clients on Friday night before going into the weekend because I was going to put my laptop away. And this baby had been not gaining well. We made adjustments. He started gaining good ounce at like 0.8 a day, which he had only been doing like 0.4 the previous week. So I was like, this is great. You're going to see your pediatrician again in 2 days. So I don't need to do another weight check. Mm-hmm. And her pediatrician was like, no, 0.8 is not okay. Your baby needs to be gaining 1 ounce a day. You need to completely stop breastfeeding, check your milk, and you need to give all bottles.
Oh boy.
And this was a mom who like when I saw her 2 days before was like sobbing that she's not doing enough for her baby. So it's just like that mental load too of like, what are you supposed to do now? Like to go directly like against what a pediatrician says. And I don't know. So there is a lot of like heavy emotional weight to this job too.
Totally. It's worth it though for all of you newbies. Keep it up. Don't stop. Stacy, do you have a comment or question?
I just want to speak to what I think it was Maya was saying about sometimes you go there and you're like, everything's fine. What am I doing here? I think also like if you've had a kid and you like think back to when you had your first kid, like someone coming to your house and being like, you are great. You are doing everything great. Your baby is perfect and your baby is beautiful. Like I think that's worth gold also, you know?
Yes.
So I think even if there's nothing, literally like no tweaks you're making for them, I think just having like a cheerleader in their corner also it's worth every penny of that visit. So
I agree. I totally agree with you. Anhar.
I had 2 things to add. One is just like this whole conversation is reminding me of a conversation I had actually this morning with a friend of mine who's a doula. And we were talking about how, like, when it comes to birth work and services around birth work, like the real key piece that I think is missing is like these conversations are happening after the baby is born. There is so much education that if moms knew this before the baby came out of their body, they would be so much better prepared. So it just like makes me think of how important it is to provide like in some form or another that outreach, because I think there's a lot of people who don't even know lactation consultants exist.
Oh yeah.
And like the ones who are coming to you for prenatal education are probably the ones who would figure it out on their own, to be honest, like to some degree.
Yeah, you're right.
And then the second thing I was thinking, similar to what you were saying, Stacey, of like that feeling of like just having somebody fangirl you basically when you're a new mom, is also kind of in the same vein. I think it's important to know that like even if everything's going great, that mom is having a really positive experience for it from you. And like if something is going poorly down the line, which absolutely can happen, they're going to feel a whole lot better about calling you up and being like, hey, last time you were here, I know I didn't need much, but at least now I know you and I feel good about you and you're a familiar face. And I'm not suddenly like, oh my gosh, who do I turn to? So I think there's benefit in that way too.
Yeah, I love that. Oh, I thought of something I wanted to say earlier. Let me say this real quick before I call you Gina. Stacy and I went to a prenatal visit together a few weeks ago, and I realized after that visit that I needed to create a checklist for the support person. So I have my PDF that I give with my prenatal visits that basically tells them what to expect in the first 24 hours, what to expect in the second, what to expect in the third, and then troubleshooting. If your baby skips more than 2 feedings, this is what you need to do. If you have low blood sugar, this is what you need to do. But then on the support person's checklist, which I included in it, I put your job is to make sure that something is happening at the breast at least every 3 hours. So if she's asleep, you can't just let her sleep. We got to wake up and do something to protect the message to the brain because it's so important. That is a slippery slope. If you let that mom sleep for, 8 hours because her baby's in the NICU, it's going to affect what happens when the milk comes in. So making that, and then, all the other things. So I'm going to put it in the chat here and share it with you guys if you want it. It will be there. Gina.
Would you be able to share both checklists, like the one for
It's connected.
Oh, awesome.
All on there together.
So I was just going to ask, like, when what Alexa was talking about, when the doctor was like, completely stop breastfeeding and the baby's like so close, like what do you do in that situation when it's like they say completely stop? Like that seems so extreme.
Are you asking me what I would say or what Alexa did?
Well, either.
Alexa, you answer first.
So I first asked mom like what her reaction or how she felt about his recommendation. And then I verbalized that I felt like that was a very drastic decision to recommend when your baby has been doing so well and you're so close to the 1 ounce mark. But I said, I will support you in whatever you want to do. If you want to exclusively pump for a little bit and give bottles so that he's gaining weight, I will walk you through that. If you would rather just add in some extra bottles and still continue to breastfeed, I can be there to support with follow-up weight checks and make sure we're on the right track. She did end up going to the hospital lactation, which I didn't know ours in the area can test your breast milk for calories. Turns out her breast milk is 23 calories. So I was like, and I had already talked to her about that's higher than the formula she was using. That's higher than what we even regular breast milk. And that lactation consultant also validated her that was kind of a crazy expectation that he has to be gaining 1 ounce a day or you can't breastfeed. But Margaret, I would love to hear your advice.
Yeah, I agree.
A little flabbergasted.
No, I agree with all of that. I would probably just provide the mom with evidence that says this is the range that we expect your baby to get to grow, and the baby's meeting that needs. As far as the testing the breast milk, when you said that at first, I didn't know what exactly you meant by that. I have heard providers say, stop pumping or stop breastfeeding and just pump so we can see how much milk you're making. But that is they're not correlated necessarily. Like that's not a good indication of how much milk you're making. So if that were the advice, I would explain to mom that that's not going to give us a lot of information. Better indicators of how baby's doing is, the growth and the diaper output and how content baby is between feedings. Those are better objective signals than if you were to just a pump and let's see what comes out with the breast or without the pump. So I am always going to, ask her, what do you want to do? What is your goal? But I think a lot of first-time moms don't realize that they're the boss, that they hired this provider and they can change, and that's okay. They don't have to listen. If this is a baby that's truly gaining weight now, she's doing the right thing, you can fire him and pick somebody else or do your own thing and just say, oh, yeah, I did that and do it your way. So I would provide her with some evidence that says, you know what, this is how much we expect babies to gain. This is from the World Health Organization. This is what we expect. I think your baby's doing okay. You can do closer follow-up with me if you want. I'm happy to send a note to your provider saying all this, or, however you want to handle it, put mom in the driver's seat.
And I think just to add on, because this one was a little bit unique and this kind of played into kind of my question with your case study too. So before I saw this baby, he was not gaining weight well, and you could see on his growth chart, like he was starting to cross. But since I have been following this baby the last 2 weeks, the baby is going like this exactly as he should. Nice. But it's almost like the pediatrician is like, oh, I don't care that you're doing well now. You still need to catch up for that to like factor in those like 10 days or a week that you were off. And so that's where I am struggling a little bit of like, okay, well, if we've corrected the issues that were at hand when I first started seeing you, and now you're gaining the appropriate amount of weight a day, but that's still not going to equal you catching back up to where you were before on the growth chart. But like, as long as they're following their new growth chart, do you say that that's okay for moms, or what's your take on that?
How old was the baby when you saw him the first time?
The first time was about 4 weeks old, and the baby is now 6 or 7 weeks old.
So when you saw them at 4 weeks, were they back to birth weight?
Yes.
Okay. And do you know how low they went?
So they did go down to like 5%, like the 5th percentile. And then as I've been following the baby, we've been up to 7th percentile. So I'm like, I'm sure that's also playing into the pediatrician.
So was all the loss though in that first 2 weeks?
Maybe like by like 3 weeks, the baby was caught back up, and she went and saw like a feeding therapist and was supplementing and stuff to get back on track. But yes, all that loss was in the first like 2 to 3 weeks.
Yeah. I mean, that's like within the normal expectations. Right. Yeah. I think
especially if we've now done interventions to correct why the baby wasn't gaining before.
Yeah. I really don't understand what this provider's looking for. Is it an old school person or?
No, and it's actually like one of the higher rated ones in the area, which I was like, great. She's, not going to refer anyone to me anymore now that we're going against. But I think having seen another lactation provider told her like the exact same thing as me. I'm seeing her tomorrow, and I think maybe I'll have that talk of like, you are in charge. Yeah. Like, we're keeping your baby safe. We're making sure your baby's fed. We're checking weights. You can choose a different provider if you want.
That. Love it.
I want to add something to like going kind of like counter to what the pediatrician recommends. One thing that I find I'm really comfortable doing and also works really well is I tell the parents what the like timeline or conditions where that recommendation would be appropriate.
I like that.
Especially with supplementation. So like I'll tell a mom like, oh yes, your pediatrician recommended that you supplement. That is a great recommendation on what to do while you're waiting for your milk to come in. Once you start seeing your milk come in, call me immediately so I can tell you how that.
Yes, I love that.
So that then you're not actually going against what the pediatrician says, but you're editing so that it's more appropriate to the mom's situation, and you kind of like maintain the trust, because I think like the mom sees like lab coat and doctor and whatever, and she wants that information.
Right.
And you don't have to go counter to her instinct.
Yes, right.
And you can kind of continue to build trust and also like not go against what the pediatrician.
I love that. Yeah. I say a lot in class, like it's unfortunate that on a lot of those discussion boards, social media boards, lactation consultants are like, doctors are idiots. They don't know anything. And I think that we can't say that to a patient, because most of the time they put a lot of thought into choosing their providers. And if we are saying your doctor's an idiot, they don't know what they're talking about, that's going to discredit us more than it's going to discredit them. So let's find ways to say, oh, that's an interesting perspective. I'm not really sure where that comes from. We can look at what the research says and what the guidance, is, and then kind of go from there. But you can always get a second opinion. It doesn't hurt to get a second opinion. Yeah. Gina. Oh, is that it? Okay. Carrie.
I have a question kind of on a case that I saw last week. So as you know, like I transferred recently into the labor and delivery, and I work at a very high risk center. And I had a mom who was pre-eclamptic patient. She was on magnesium for a while. And actually during her delivery, we realized how high her mag levels were. She's like, I can't get my eyes open. So baby was born, put baby to breast, didn't want to feed, nothing. Would have nothing to do with it, was so sleepy because of the magnesium. I tried hand expressing, nothing. So then mom, had said, I'm really tired, sent baby to the nursery for like 6 hours, and mom just slept. And I was like, should we go in? Maybe ask her if she wants to pump? And my preceptor was like, no. Like, I kind of wonder, like, how would you like approach that?
You're L&D preceptor, just so we're clear. This is not your lactation
No,
preceptor.
no.
Right,
My
right.
L&D
Yes.
preceptor was like,
Yeah.
no, we're gonna let her rest.
Yeah.
Blood pressures were still really high too, so we had to get that under control on top of everything else.
Yeah.
If you're still stabilizing mom, or say like the nurses are still stabilizing mom, how would you protect the milk supply at that point? Because like baby had
Yeah, that's a great question. And I actually, somebody in this new cohort brought up the impact of hypertension and magnesium, and they said, "Oh, I'm pretty sure that magnesium sulfate reduces your milk supply." And that's not what the research says. I wrote a blog post about it recently. It's public. You can read it now. It's the practices around what happened when you give magnesium that leads to that decrease, because moms feel really crappy and don't want to breastfeed or pump or whatever. And they usually, it increases the risk of them being separated, because at least at the hospitals where I've worked, if a mom's on magnesium, somebody else has to take care of the baby, or we can't leave the baby with you. So I have, it's really going to depend on the care team taking care of them. If it were me and I was her L&D nurse and lactation was not available, I probably would have held the flanges on there just so we could get 10 minutes of stimulation. I've done that. I've done that countless times. I had a patient one time that had a liver rupture in labor and was in ICU. She was totally in an induced coma, and we had lactation 24 hours a day at the hospital, and we took shifts and turns, and we would go out there during our shift and hold it if her mother or her husband weren't there to do it. So that's what I would do. You did it once or twice in that 6-hour time. She got some rest. We probably don't collect anything, but you protected the message to her brain. So that's probably how I would have handled it. If the mom was comfortable with that. It's just those long stretches in the early days are so critical. They really, the research is more and more clear that what happens in those first 24 and 48 hours with the message to the brain sets us up for success or a really steep mountain to climb to regain that full supply.
Yeah, and I felt bad too, because have this going, I'm pursuing this and I'm coming in as this new nurse, and they don't know me from a hole in the wall, right? I'm coming from ICU. They think I don't come in knowing things like I know everything.
Yeah.
And but mom had no interest. I put baby to breast and I'm trying to hand express mom. She looked at me, she goes, "Can I get formula?" And I was like, "No." I was like, we're gonna try first and then formula later. But baby ended up getting formula in the nursery because mom just had no interest in pumping or anything. So I think I'll push.
Yeah, that's going to play a role, what mom wants for sure. But, best outcomes would be if you could protect the supply, get the partner to hold it, get somebody to hold it for her. Even 10 minutes is better than nothing,
Okay. I'll do that next time when I have a case. I'm sure I'm going to, because of how high risk this place is. So
awesome.
Thank you.
Yeah, Amber.
I just have an overall question.
Yeah.
Because my daughter's 6 and it just seems like the same things are still kind of coming up. So not that anything's going to discourage me from becoming a lactation consultant, but I'm very I just feel like are people overall noticing that other healthcare professionals are just still behind and not on board with what lactation consulting, what's best for baby as far as best practices? Because even my daughter, I remember she had a lip tie, which was significantly reducing her ability to even breastfeed. Took her to my pediatrician. My pediatrician said, lip ties don't exist. She told me they don't even exist. And I was like, what are you talking about? Because the lactation consultant told me that it did.
Yeah.
So obviously I listened to the lactation consultant over my pediatrician because I was very determined to breastfeed.
Yeah.
But it just seems like still our other healthcare professionals
I think that largely people respect that breastfeeding is important, and most hospitals are really committed to making sure that breastfeeding is a priority. So I think in most cases, I think it's the outlier that is really backwards.
Okay.
You're just going to hear us talk about it because this is where we're seeing it, but it's not the general. Most of the time, the patients that I take care of, their providers are really supportive of breastfeeding. And for even providers, and you'll start seeing this too, even providers that are just that tell the mom that you need to give formula, in most cases, not in Alexa's case, but in most cases, it's just because formula is easily accessible and they think we don't know if mom has enough. This is a way to measure and make sure baby's getting enough. It's not about anything special about formula. It's just because it's easily accessible. But most providers recognize the benefit of breastfeeding and definitely want moms to breastfeed. It's not the other way around.
Okay, good. Thank you.
Yeah, of course. Naya.
I have my own question, but I just want to respond to what Amber asked
Yeah.
also. I agree that I think most providers recognize the benefit of breastfeeding. I think that where the education is lacking is how to promote success.
Yes, definitely. Definitely. And if you haven't listened, I would listen. I have a couple of episodes from breastfeeding medicine physicians. So that is a field that's growing and they are filling the gap. So they're like a doctor and a lactation consultant all in one. They're not taking our jobs, but they are filling the gap. So when we need help to help figure out why this dyad isn't working, whether it's the baby issue or the mom issue, these breastfeeding medicine physicians, and we have a lot in our state that we can refer to that really can help to solve things. So it's a good thing and it's getting better. Maya, and I hear there are now residency programs for breastfeeding medicine, which is awesome.
The question that I was going to ask was, I hear from a lot of patients that their pediatricians have recommended limiting the baby's time at the breast. Is that something that you like understand that recommend? Like, I even asked my children's pediatrician who loves breastfeeding and definitely is like very raw about breastfeeding.
Yeah.
Whether she makes that recommendation and why she makes that recommendation. And I couldn't understand her if there was any wording that recommendation.
There's sort of two ideas behind it. There's one idea that if a baby spends X number of minutes at the breast or longer, they're going to burn calories. And they say that a lot about preterm babies. There is absolutely not one word of evidence that supports that. Nothing. No evidence at all. I have heard a provider tell me, or a patient tell me, a provider told her once that after 10 minutes, the baby is sucking air.
Air, because there's
That
air.
provider obviously doesn't understand anatomy, but anyway. So that's that. But I definitely will recommend that we limit time at the breast for a baby that's not gaining well, or a baby that's on a triple feeding plan, because I want their time at the breast to be really efficient. Did I freeze?
Yeah, but I understand what you're saying.
So
you want
I want the time at the breast to be efficient.
Yeah. Like if the mom, like you would recommend it in the case where the mom is going, like she wants to practice breastfeeding and also she has to pump and
Yes.
Like, really want that baby to get.
So I would say only keep them on as long as they're active. So I'm teaching them the difference between this and gulping.
Yeah, I see a lot of patients that I need to like they'll ask me, well, how many minutes do I spend on this cycle and versus on this one? And I'm watching, like everything is watching the clock. Baby.
Yes.
Milk.
Right, exactly.
The baby is taking in the milk.
Exactly.
And then I'll write in my notes, like in my care plan to them afterwards, like I really love to see how you're leaning into your intuition. Like,
love that.
It's just really like it's so hard, especially for first time moms, and a lot of them are very like, I forget which side of the brain is which, but like the numbers people, which like I am also a numbers type person, so I understand the tendency to like want to track everything and want to see them, whatever, but some of these moms have a really hard time getting that off and just watching the baby and
Yeah,
watching.
I get it. I get it. So then we're going to give them other things to count, the number of diapers, the frequency of feedings, and that kind of thing. Yeah. Awesome. Jeanette.
I have a case question.
Yeah.
Sorry, my camera's blurry. I don't know why I got extra blurry.
It's okay.
Okay. Um, okay, so this is from a perspective of like a nutritionist hat, right? So I work with breastfeeding dyads, but I'm not the direct, breastfeeding person. But I had this mom who had a 14-day-old baby, and this was like a phone counsel. And she had told me that the baby went days without stooling, oftentimes 3 days without stooling. And the doctor was not concerned and told her to give the baby Pedialyte so he could stool. So I brought this up to like our lactation consultant at WIC, and she didn't seem concerned. She said, I'm not concerned that the baby doesn't stool every day. But I brought it up to my hospital preceptor, and she was like, absolutely not. Like, that is
Yeah.
not
Did they
okay.
forget how old the baby was?
I told her. And so the other issue was that the baby was not up to birth weight at 14 days, was still like 5 ounces off. So when I told her that the WIC lactation, she was like, the consultant, she was like, okay, now I'm concerned. But I feel like my red flag started when there were no voids
100%.
or stools, I'm sorry.
100%.
So my struggle is like, I feel like a lot of lactation consultants have like different opinions, and like knowing what to follow, like what, like as a student, like what is right, what is wrong. So my hospital lactation consultant says that's old practice. But then my WIC lactation consultant, she's only been practicing for like 6 years. So I wouldn't say she's like old school.
Yeah, but it could be who she learned from.
Yeah. So what is the right answer?
The right answer is that we expect 3 to 5 stools per day for the first, 14 to 16 weeks of a baby's life. And that is the number one thing that we look at to make sure a baby's getting enough milk. So I'll find a citation for you and send it to you, because that is key. And the best way that you're going to fight misinformation is by providing evidence.
Okay, because then that worries me that like our actual lactation consultant at my job is like not following the right protocols. But then how do you confront her about that? Like, hey, I don't think that's.
I don't understand. I mean, does the pediatrician know this baby's not up to birth weight? And then to give Pedialyte, we're not going to get any weight that way.
Yeah, that was his suggestion, is to give Pedialyte. And so she says when she gives the Pedialyte, he stools. And this is her 4th child. And she breastfed all her other ones and said they all had that issue with not stooling in the beginning of life. But they all also had all tongue ties. And
Well,
but this
remember,
thing
moms aren't great historians, so maybe the baby didn't stool on day 1 or 2, but day 14, we would expect this baby to be stooling.
Yeah, and to go like 3 days without stooling, I felt like that was a little excessive.
That's a lot, yeah.
In my opinion.
I was just gonna say whole picture, not just paper, whole picture. On paper, that scares me.
Yes.
But what else? What does feeding behavior look like? What does weight look like? I mean, and I'm just, not that you didn't say that, but I always look at all the things, because sometimes on paper, it sounds awful, and then like like feeding behavior, and and then I get there and the kid's like a pro at the breast and is gaining weight. I'm just, so I always say whole picture.
Yeah, look at the whole picture. Yeah, definitely.
Sometimes they look good on paper, and then when you see them, you're like, that baby looks not good.
Right. Exactly. Let me find some citations and I'll share it with you, and that's what you can use next time if it comes up again.
Okay, thanks.
Yeah.
I ask if the expected stooling pattern changes that early if the baby is also getting formula supplementation, because that comes
good, because it could, I wouldn't expect it to go 3 days, but it definitely can change stool output.
Because like in the first few days we want to see like many poops,
right.
and if they're getting formula also, like, do we still want to see many poops?
So the WIC reasoning behind she's not like surprised that the baby hasn't been stooling, is she says because the baby is absorbing all the nutrients. So I thought
Baby is
that
not
was,
getting enough nutrients.
Not
It's not
every
back to birth weight.
yeah. And then so that was like her reasoning behind it. And so it just seemed really odd that, okay, the baby's absorbing all the
All right,
nutrients.
I'm going to write a blog post about poop.
Okay.
Okay, let me work on that for you. All right. All right, I want to give you guys a couple of announcements, and then if you want to go, you can go. I want to, first of all, I know some of you heard me with my Sob Fest. Some of you didn't, but you may have noticed I had to change all of my names. IBLCE saw that interview that they wrote on that USLCA did of me and got very upset that I called myself the IBCLC mentor and the IBCLC mentor podcast and sent me a cease and desist letter. So I had to rebrand everything. Yes. Yes. It was a stab in the heart. I know it was a form letter, but it said something like your use of this mark basically like discredits our agency. And I'm like, are you even looking at what I'm doing? Anyway, I had to rebrand. So that's why the podcast has a different name now. Now I'm calling myself the Lactation Consultant Mentor. Doesn't have a nice ring. I had to tear up or cut up so many of my new stickers that had just come in the mail, but I'm going to get new ones. But that happened. I also had to rebrand the app. So it should automatically update in your app store, but it's now called the Lactation Consultant Toolkit instead of IBCLC Toolkit. But I want to tell you, we have a brand new update for today. So if you haven't noticed yet, we have a couple of updates that came out recently. One, we added the weighted feed calculator in there. For those of you whose scales don't automatically calculate that. So that's in there under, if you click on feed, it pops up and it'll say feeding calculator, triple feeding calculator, and then weighted feeding calculator. We also updated, this is brand new today, the growth calculator. You can now calculate by age or today's date. And that's going to make it super precise because I've had people give me feedback and say, this doesn't add up to what I see when I look at the growth calculator or growth chart. And the reason for that is if the baby is like 3 weeks and 4 days, it's going to look different than if you put just 3 weeks in the calculator. It kind of rounds it. So now you can do it precisely to the number of days the baby is. The next update that's going to come hopefully this week is we're going to put reference ranges in there saying this is how much the baby should have gained by this period of time, which I think will be really helpful. And always with this app, I want to, right now you can just screenshot it and share the screens with your mom. So, if you want to tell them how much milk their baby should get or what their growth looks like. But eventually I want to be able to email the screen to them so that it's all on one thing. So stay tuned, but we're open to thoughts and suggestions. So if you have any suggestions ever for the app, give them to me. We are working on them and updating it constantly. We also have a metric only mode for you non-US people. So you can put it in metric only if you want. Anhar.
This is unrelated to the app change. Going back to stool.
Yeah.
I just wanted to pop, I'm going to put the link in the chat.
Okay.
There is a resource, and it's like heavily cited. It's all like valid research, but it's about what expectations you can, and you can share this with parents, they can expect in terms of what stool should look like and what quantity should look like.
Love it.
It kind of leans a little further into when they're starting solids, but it does also have visuals of what they can expect from just
Amazing.
a regular breastfed baby. So
amazing. Thank you so much. Diana.
Okay, two things. First, Margaret, I just wanted you to know that with your app, it's like doing something kind of weird. This is just a display thing. I'm going to open it. Let me see if this works. Those are my children. Yeah, so did you see how like at first the logo is cut off and then it looks normal? It's not a big deal.
No,
but
I know. For me, it opened and then it kind of shrunk a little bit.
Mine won't let me download it at all.
Oh.
Yeah. Weird, right? It says unable to install lactation consultant toolkit. Please try again later.
All right, let me look at that.
Oh, yeah.
All right, what else?
Okay, and then also, I don't know if anybody else would be interested in making a WhatsApp group with us. I think it's cool to have like a mix of people who are more experienced, starting their practices, and students and pre-students. So I can put my number in the chat, and if you want to text me, then I will add you to a WhatsApp group.
Love this. Love this. Awesome. Naomi.
Thank you, Diana. That is a great idea. So you might already have this, Margaret, but I might have been one of the people who asked you about the growth chart because the folks I work with at the breastfeeding center are always like wanting to get a growth chart on the kid. And they're like, I think I was telling you, they're always like pulling up their iPad and like adding in all this separate stuff. And it's like such a nightmare.
Yes.
So on here, if I punch in the baby, like if the baby were weeks old, I would get the weeks tab and I would put in the age and the birth weight and the current weight. And will that pull up a growth chart?
It doesn't at this point. It does tell you the percentile though. So
it just gives you a percentile.
Yeah.
That they were and that they are, or they just tells you their current percentile.
That is a good question. Let me see. So
it just gives you today's like
yeah, it gives you today's percentile.
Okay.
So you would have to know what their other percentile is. So here's the thing about the growth chart. If we were to put a growth chart in the app, we would need more data points.
More data. Yeah.
I mean, I could.
Can you do it from the birth weight? Because birth weight's there. Can you graph it from the birth weight?
Probably. Let me talk to Byron about it. Yeah, we're open to anything.
When are you releasing the starting platform?
Good question. We're working on that right now. So I told another student today that I want to have it live by like after the next exam. So the next exam is in mid-September. So right after that, I want to have it ready to go.
You said a charting platform?
Mm-hmm.
Oh.
I already use it. He already built it for me, my husband, but we're building it to scale so other people can use it. Yeah, it's awesome.
Well, if you could find a way to add in more data points,
absolutely,
I think that could be cool.
Yeah. So you're saying your people want a visualization of a chart?
They want to drop multiple weights in.
Yeah.
And see the whole chart, like going, are we going up? Are we dropping off? They want to see it all. And because then on multiple visits, they'll be like, okay, let's add the next weight and see if we're still going up or if are we on the curve or whatnot.
All right, we'll work on that.
I'm in
but for sure have that in your charting app, okay?
Yeah, and I'm
so we're but they're not on the hospital. If you're not at the hospital, you don't have a
Megan's saying I should connect the app to the charting platform. Yeah. What were you saying, Diana?
Oh yeah, I'm interning in like a big hospital system patient, and we bring up not me, but my preceptor brings up the growth chart like frequently, and parents are really interested in that.
Yeah, we'll figure out how to do that. The other piece of news I want to give you is that if you are going to be taking the exam in September and you're anxiously waiting for the window to open to sign up for your exam, I am going to relaunch the exam prep course when the window opens. So don't buy it yet, or don't look for it yet. Diana, it's going to be completely different from what you already purchased because not completely, but I'm updating everything. So it will, don't try to log in yet because it's going to be fresh with the new things. I just took the exam again, so I have new things I want to add to it. I know, yeah. So I will, so just stay tuned. That's coming. It will be available as soon as they open the window. So soon. Yes. Thank you, Rachel. Thank you, Rachel. It will be on my exam prep. Don't worry. All right. Any other questions or thoughts or cases? I'm so grateful for all of you coming tonight. This was awesome.
Do you want to hear about my relactation?
Oh yeah, do tell.
So
Did you
this
listen
is
to the
also a case
podcast
of it
episode?
sounds good. And then we're going to do nothing after Megan leaves, by the way, just so you know. And so I told you that at one of the hospitals that I work at, I have a very unique population, primarily from India.
Yep.
And I love working with them. And they found me after, I guess they went home, they found me on the internet. And I did a home visit. And I mean, they call me on a Monday and want a Tuesday appointment, but don't confirm, do anything. So I booked someone else for Tuesday, and then I scheduled them for Wednesday when they finally responded at like midnight. I called them the next morning and scheduled it. And they're leaving for India on Saturday for 4 months. They would like the baby to be able to breastfeed by then. And I said, okay. So what's been going on? And we're struggling. We've been giving formula, so we're struggling, to latch, and we just really want to make sure baby can nurse at the breast. Okay. I'm like, all right, now just gonna tell you right now, I learned a valuable lesson that my private practice is still very, very new and does not have all the foundational pieces. And I know that, but this one I felt like bit me in the butt a little bit because I do more of the gathering when I get there instead of all these sheets. It sounds good, but having all that worked out, I don't have that all figured out yet. So I'm
I
just
don't
kind
do
of
that. I'm opposed to it, but you probably knew that
yeah, but
already.
I'm just saying, for me, I feel like it would be better time-wise management and all that. I'm not saying I'd get what I need, but I would just say this was very much, that's what they said. I showed up, baby is 6 weeks old. I saw the baby at the hospital just coincidentally. And it's now like 11 and something pounds, but it looks like a 4-month-old baby to me. Like, I don't know how to, like, it's just a very solid, not chubby at all, but just I don't know, looked very tall, it looked like a 4-month-old baby, like in size in theory. And it's 6 weeks old. They haven't pumped in 4 weeks, and she doesn't remember the last time the baby breastfed, but she thinks maybe 4 weeks ago.
Why is she relactating? Is it like a cultural pressure thing? She wants people to.
I mean, she wants to. So what I've seen, and this population is really, really high, is a very big insecurity about milk supply, no matter how much you educate them on biology and physiology. And there is a big pressure to use formula because you can't see the milk, so you can't verify it. So then they start really early, and then all the normal stuff happens, like the baby gets irritable at the breast, and blah blah blah. And then everybody goes, well, and because I started supplementing because my milk supply wasn't sufficient. I said, who did you meet with? To determine that, just so I can have an understanding. No one. I don't beat it down, but I just go, I explain to them that I really wished, that that we could have, I don't like beat them down, but I'm like, right. I think in the future we want to analyze that or look at that a little bit closer to when you were concerned.
Yeah. Right.
I said, but I said, primarily, we need to look at what your output looks like right now. Let's get the pump out. She goes, oh, I just got new flanges. So, I mean, she kind of made it seem like she'd been doing it. And then when I find out, no, we haven't. So I kind of let her do her thing because, modesty is really big with this particular group of people that, not necessarily Indian as a whole, but just her. I could tell the type of dress she wears when she was going to pump. She wears like a thing that comes down to zippers to pull your breast out. It is very modest. We go into a bedroom. We don't do it in the living room. It's just kind of and I had to kind of see what she was doing before I could really analyze the situation. I mean, in one breast she had drops, but when she had flatter nipples, so it was a little hard to distinguish, and there's not a lot being shown. So I have to kind of do what she's comfortable with before I really, and really that flange was barely. I mean, it was on her nipple, but it was cutting off right below the nipple, like no gap, no, no nothing. So, I mean, that had an impact. And then when we looked at the right, I said, I think in the future we may need to use a mirror that we get settled and we get comfortable because she didn't even have it on her nipple on the right breast. And like, it didn't have it centered in the flange. Wow. So absolutely, I mean, you could see a circle, but some people go, well, why didn't you correct her midway? These are situations that you can't make up. I'm not going to tell her, please show me more of your breast. Like I have to find these balance pieces with it. Yeah. And so we talked about that we need a very intense pumping plan, that this is going to take some time, that they of course want medication, and how do I fix this? That's why I messaged you. And I said I would look into some research about some either herbals or getting domperidone, because they're going overseas, but I don't know what that looks like. And I got their information of what city and what basically what state in India that they're going to be at, if I could try to find an IBCLC that at least could help them with the latching piece, if we could get her milk supply up and working. And I set very low expectations because of the lack of, and this is our first baby on top of that. So just set very, understand this may not work, it may work. You have to see how your body responds and, kind of go from there. By the end, they're like begging me to help latch the baby. I know this is not going to work. I mean,
no milk available.
It's so, and I'm like, I said, I'm more than willing to help you do this. I said, but the baby is going to be irritable at the breast. I taught them how to pace bottle feed so we could slow it down and try to work on the transition. I used a nipple shield. I mean, the kid just like screams bloody murder. I'll also tell you, just because of my background and my experience with special education, I am pretty certain this child has a disability that I did not see at birth and did not jump out at me. But at 6 weeks old, I am confident that possibly this baby might be on the autism spectrum disorder scale and or some other developmental disability. It has a lot to do with the eyes and just certain behaviors, not like low tone, like couldn't form, muscles, but just I don't know how to explain it. Could hold their, neck up decently for 6 week old, like, but it is just was very like when you held the baby like to you, the baby didn't like try to grab you. It just was like there. And it was a whole picture that was really hard to describe. That was emotional for me. And then I checked in on the next day. I didn't hear anything. And then the next day she goes, haven't had a chance. I'm going to get pumping soon though. And I'm thinking to myself,
oh boy,
I can't want you more than, but I will tell you that when you walk into thinking what's going to be possibly a triple feeding plan turned into a relactation.
Oh my gosh. Megan is not in left field with this wondering about the baby being on the spectrum. I actually did a research recap about a paper. Did you listen to it?
That one, and I thought of a family that I know right away.
Yeah. Yeah, it's pretty interesting to think about that. After I read that paper and did that research recap about that paper, I remembered that I had this one client that I saw her with her second baby, but her first kid is on the spectrum, diagnosed, all that. And this baby does not like to breastfeed. It would only breastfeed at night, basically when all the stimulation was super low. It was pretty interesting. So I'll be interested to see what happens with her. But anyway, thank you so much for sharing. Thank you guys all for coming tonight. This is definitely a long session, but I am glad we had lots to talk about. I'm glad you guys all came. As always, reach out to me anytime with your suggestions, your questions, any blog post you want me to write about. I got one I'm working on right now for Diana, so it's on my to-do list. So send them my way if you think of anything. And yeah, I'll talk to you guys soon. Reach out with anything.
Thank you.
All right.
Thank you. And my number's in the chat still. If anybody else wants to.
Yes. Feel free to add me to it. I'll do my best to participate.
Okay. Can I say a really funny story?
Please, yes.
It's pretty short. I was seeing a family and the mom goes, "Oh, I was trying to make things that would increase my milk supply. I made these like energy balls with like flax and peanut butter I found online, whatever. And what do you think about that?" And I was like, I mean, it sounds delicious. Like, I hope you enjoy. And then her wife goes, "Well, like we're Filipino and all the like aunties are telling us like there's this vegetable that you have to eat that increases your milk supply and like we totally wrote it off as like it's not a real thing. But like what do you think about this? It's kind of like spinach. I don't know if you ever heard of it. It's called moringa."
Oh yeah.
That one.
That's a nerve. That's what, yeah.
I don't know.
Yeah, worth a shot. Why not? That's funny. I have a patient right now. She's from India. Her mother is here visiting from India, doesn't speak any English, and keeps making her all these teas with all kinds of herbs and things. And the mom's like, I don't even know what the English word is for them, but I'm like, whatever, keep doing it. I don't think it's hurting anything.
Yeah. The lactation consultant that like the practice that I work for, she's an herbalist. Like she's also a nurse practitioner, but she's like
Who is it? Remind me.
Her name is Gail Macklin.
Oh yeah. Yeah.
She's a pharmacist.
Yeah.
So, like they're very educated about all these like alternative therapies and stuff. So sometimes I have in mind like I want to ask them questions about these things. But
You need to get that herbal handbook. Did you listen to my episode with what's her
Yeah,
name?
I did.
Melissa Cole. This is a good resource. It's not very big, but I love the way it's laid out, so it's a good resource for you.
What is that called, Margaret?
This is called the Herbal Handbook for Perinatal and Pediatric Wellness. But I love the way she laid it out. She cited all the references for the herbs. I did an episode interviewing Melissa Cole about this, but this is available. I think it's on Amazon. Great.
It is. I just put it in my cart.
Huh?
Write it down.
It's on Amazon. I'll link it.
Okay. Thank you. Yeah.
Having things that I want. I found out that the Baby Friendly USA office is literally around the corner from where I grew up. Never
Oh,
knew.
yeah.
I listened to that episode
Yeah.
right after I was there.
Amazing. Yeah. I love Eileen. She's
Like,
awesome.
I want to visit the office,
You
but I was
should.
and
You
then
should. You totally should.
I
Yeah,
totally
I'm excited about the conferences they said they're going to start putting together. So I think that'll be really cool.
sounded
Before
like doing conferences for IBCLCs though.
Not yet, but yeah. Wait 1 second. I want to see what the episode is this week to give you guys a teaser. I have my episodes scheduled out through like June right now, so I don't know what they are, but I want to tell you what's coming up because I'm excited about it.
My goal is to be like cool enough that I get to be featured on one of your episodes, but like I don't have anything that I'm expert at, so
You don't have to be an expert. I interview lots of my former students, so whenever you're ready, I will interview you.
if you ever have
Ma'am, I
an
was
episode where you want to like ask a bunch of different people what their input is on something that's like you don't have to be an expert, you just have to be
Love that idea. Yes.
I'll be there.
I love that idea. Love it. What did you say, Anhar?
Oh, I was just gonna say my mother-in-law made me one of those. Like I literally don't know what was in it teas. And I felt so bad because she like went and got so many different things and it was like from all these different specialty shops. And the second she left, I dumped it because I could not, it had fenugreek in it and I couldn't handle the smell. And I was like, I'll figure it out.
Where did you deliver?
I delivered in Hinsdale.
Hinsdale, okay. That's right.
Yeah.
All right. So this week, my episode is with this really cool researcher who lives in Germany. She's an American. And I interviewed her about a research project she's doing on cataloging it's called the Pumped Project, cataloging all of the pumps that are available for personal use pumps for moms in Germany. It's really interesting because it's something that we can sort of use her model and we should do it here to catalog it and see. I mean, the other thing that's pretty interesting about it is like the flange sizes, the instructions that come with them, like really kind of assessing what is available to moms and how we need to kind of fill the gap. It's pretty interesting. So that's the episode this week. And then next week, this one's super exciting. I interviewed this physician who started Nigeria's first breastfeeding clinic. So that one's super exciting. I can't wait for you guys to hear that one. All right. Have a good night,
For the one
everybody.
on this week, Margaret, for her cataloging, do they have any kind of regulation around breast pumps? Because I'm just thinking, like, how would we even do that when there's so, like, go on Amazon and there's like 100 that you could knock off brands, you know?
Yeah. That she cataloged those. So yeah.
Wow.
Yes.
That's wild and impressive.
Yeah. I did write a blog post. I don't know if it's live yet about pumps in the I don't think it is. Pumps in the United States and how they're really poorly regulated here. Yeah. So that'll be an interesting blog post when that comes out. I don't think it's live yet, but stay tuned.
All right.
All right.
Thank you.
Bye, everybody. Thanks for coming.
Bye.
See you later. And Anhart, the offer goes for you as well. If you ever want to do a hands-on, whenever you're ready for that, you're welcome to join me.
Definitely do.
Okay.
Thank you.
All right.
That's
Yeah.
amazing.
Whenever you get to that point. So
Perfect.
cool.
Thank you so much. I
All
appreciate
right.
it.
You're welcome. Bye, everybody. Have a good night.
Bye.
See you later.